Good morning, class. Today we're going to be covering a couple topics here. We're going to be discussing some management of bleeding and splinting of fractures with available resources that we have around us and with us around the house. But before we get into the actual skills portion, I would like to just take some time to review some basic anatomy of the skeletal system and the vascular system within the human body. All right, so we're going to be covering two kind of major different things here: the skeletal system and then the vascular system with our arteries and veins throughout the body. The skeletal system will just be kind of discussing some of the major bones, some of those that these obvious injuries that you'll see, down to smaller fractures within the hands, and then we'll discuss the splinting of those injuries later in this presentation. And then when it comes to bleeding, we'll be discussing the major arteries that run throughout the body, the veins, and then again we'll be discussing some of the signs and symptoms, what we can do to stop some of that bleeding, and then all of these skills we'll be using things that you can find around the house or within the environment in which you're in. Alright, so the skeletal system and our adult bodies will have 206 bones total. Everybody uses their hands and feet, and in your hands you have 27 bones, so quite the opportunity to fracture one of these doing something simple or in a traumatic incident. And then walking around on your feet, you have 26 bones in each foot. So again, you walk on those. Some people have more pressure on their feet than others, and then that can cause stress fractures. You can drop something on your foot and break one of those. And so within like your hands and your feet, these could be like some minor, not so obvious fractures, but you could still have some pain within those. And again, we'll talk later on about splinting those smaller injuries, how you can do that with things around your house. And then even down to like a femur fracture, we can discuss kind of how to splint that. Now, if you do that in the field, always call 911, or you will be 911, so you'll have the proper equipment. Tibia fibulas, you can have some obvious angulation with those as well. And so we can talk about splinting those things, even up to your humerus, your radial, your ulna, even a simple clavicle fracture, how we can splint that or support those. We could discuss those. All right, so the vascular system throughout the human body, you have your arteries and your veins that run throughout the body, and what's responsible, for getting all of this around is obviously your heart. That will pump everything out, circulate that through the body, through the arteries, come back, return through your veins, go through your respiratory system. And so some of the major ones that you want to definitely be aware of, are obviously your femoral artery, femoral vein running out each side of your leg. And then you can have your brachial arteries up here. You have subclavians, your jugular veins, carotid arteries, radial arteries down here as well. And so we'll discuss later on about types of pressure, types of bleeding that could be involved with these arteries and veins, and then how to stop those and try and prevent the bleeding. Everybody's always heard the phrase, blood goes round and round, air goes in and out. So you want to keep that blood within the body and try and prevent anything. And again, we'll discuss more in depth later on in the skills about things you can use around the house. And then, hopefully at the end of this video, maybe we can get some ideas on how to prepare better for these emergencies within our environment that we're working or live in. So let's get into some of the ideas behind our skills here. We're going to discuss some of the things that we can do to manage fractures and bleeding injuries and using things around the house. So with bleeding control, we're going to talk about simple things from applying a Band-Aid, direct pressure, to makeshift tourniquets that you could do at the house. Hemorrhage and blood loss is a huge leading factor when it comes to pre-hospital death and death out in the field. And these are things that can be prevented as well with some proper education to you, your friends, your family. So let's get into some of that. So minor bleeding can occur from a simple injury as far as like slipping, falling, and skinning your knee, or brushing your hand against a rough surface, getting a splinter. You can even have some minor bleeding if you're diabetic and you have to prick your finger. You can have just super minor bleeding. It could be capillary bleeding. And some of that stuff can just be easily controlled with just a little bit of direct pressure. Even putting a Band-Aid on there that applies a little bit of pressure can really help stop some of that stuff. Some people, freak out with the smallest sight of blood. So to them, this could be major bleeding. This could be a major emergency. And so just try to keep that in mind too if you're helping treat them or working with them. And again, you can use Band-Aids. I'd say the majority of people have Band-Aids within their home. Now, if you're outside working in the field and whatnot, you can always just use your shirt, kind of wrap it around the finger if it's just minor bleeding, or eventually it can just clot itself off, as long as there's no other factors, clotting factors or any blood thinners that you're on. But on that note, as far as blood thinners, minor bleeding, as far as capillary bleeding, if you are on a blood thinner or there is a person on a blood thinner, direct pressure would really be advised, to apply that and then hold direct pressure until that's stopped with those. And then, really, especially in the older population, a small skin tear can lead to major bleeding. Just patients on a blood thinner can nick their foot, and especially if they're on thinners, they have varicose veins. These things can just bleed nonstop unless direct pressure is applied. So minor bleeding can just be really controlled with a Band-Aid or a t-shirt or a washcloth, even just applying a paper towel to those injuries. So severe bleeding, I would fall under as large vein involvement or arterial involvement from small or large arteries. And these injuries can occur, really from anything. You fall on a glass coffee table, or you're working outside with a chainsaw and you slip and fall. Even, this can come down to violent attacks, or, even in today's day and age, violence is more and more prominent. So even falling victim to, violent crime out in town, controlling that bleeding can really just help stop, death inevitably. And so direct pressure is a great source. As you can see in this photo back here is an abdominal wound. And within that, injury, we can suspect, she has her inferior vena cava, her descending aorta, things all in that area. You have your internal external iliac arteries all coming down in this general area. So we're not really sure what's involved here, but as we can see, there's quite the amount of blood that's coming out. This gentleman here looks to be using some type of clothing or bulky dressing, and he's applying direct pressure to that wound. And again, applying direct pressure down over the injury, trying to stop that bleeding from happening anymore. And, other things that can be involved too is, we have our solid organ kind of sitting right over here. We have a spleen, then we have, our liver sitting over this way. Pancreas is in this area. And so a solid organ can also be involved, and that could be the culprit of some of this major bleeding. So it's always just kind of good to, recognize these things and what we can do to help stop some of that bleeding. And so in the next slide, we'll talk about some things around the house or things that you might have on you that you can utilize to help stop some of this bleeding. So outside of an ambulance or in hospital setting, we may not have access to large abdominal pads or large bulky dressing, trauma dressings, to apply to serious bleeding or wounds that we can come into encounter with. And so with that being said, these are some things that we can kind of use around the area here. If you're at your home, again, the majority of people will have towels or a sweater or a hoodie of some sort, some washcloths, large blankets, any of these kind of large, fluffy clothing or towels and stuff. And so using some of these things, we can use that to apply direct pressure to a wound to really try and help stop some of that bleeding. And just a side note too is if you add dressing or a bulky dressing to an injury, we never want to remove it once it's been added. And so, you'll see some people that'll just keep putting a towel on, take it off, put a new one on, take it off. And so we want to really avoid that. And so if you can just put one on, hold it. If it becomes soaked, let's just add another one on top of that and keep stacking until 911 shows up, EMS arrives, first responders, and then they can appropriately try and apply some things to that. So major arterial bleeding and tourniquets. So tourniquets, I would say, has definitely come to light in the last few years, especially in the civilian market. Military has done extensive, research and had years of experience using these within the field. Now, people may not have a tourniquet. Not everybody's going to carry a tourniquet on them. They're not super, I would say, common in everyday life with most people. They can be expensive, especially if you get like a name brand reputable, like a cat tourniquet. Those could be expensive for the average person. And so having this with you may not be, an option. These tourniquets can be used, on your extremities. Never use it on somebody's neck. It's always a joke, but just to reiterate that you can't use a tourniquet on somebody's neck. Now, you can use these on arms and legs. And so if you have, a brachial artery, your radial artery, femoral artery bleeding, you can use a tourniquet on these extremities to help stop the bleeding and prevent any further blood loss from that. So let's say you don't have a tourniquet with you at the time of this, emergency, and you really need to give aid to somebody. Everybody always sees on the movies. Everybody's always seen somebody do it. They'll pull their belt off. They'll put the belt on, and they'll pull it down and cinch it down super tight. Thinking that they're occluding this blood flow. However, when you pull that belt down and you try and cinch it down, there's always this like little gap that kind of sits up there, and you're not really fully compressing all these arteries and muscles and stuff to really occlude the bleeding. And so belts are not really the best thing that should be used when doing a tourniquet out in the field. Now they do have the width is good. You always want a tourniquet that's wide. You never want to use a shoestring, fishing line, or 550 cord because it's so narrow that the tighter you get it, it can start cutting in to the extremity. And so now we're just adding injury on top of injury, and we don't want to continue that. We want to avoid that. And so in this next slide, we will be discussing some things that you can use that I've been taught in the past on what you could use as a homemade tourniquet. So what I was taught in the past, and what I believe to kind of be like one of the best homemade tourniquets, is using a t-shirt of some type, or even, like if you happen to have a triangle bandage, or even a bandana, using that, and then having a sturdy, windlass. You could use a wooden spoon, you can use a long flashlight, you can use a long screwdriver, anything that's pretty sturdy enough that you can help use to twist and create tension onto that. Now there's a little bit of technique that I was shown, a little tip and trick with doing this and using this instead of using like a cat tourniquet or a soft tee or SWAT tee or anything like that. There's kind of a technique to applying this type of homemade tourniquet. But this, this will encompass the width. You'll have the proper width of the tourniquet, so you're not creating any like tissue injury and creating any more injury on top of that. And then you'll be able to get the appropriate tension. You're not going to have the gap over the leg like you would with a belt in that instance. So this one you'll actually be able to like fully circumwrap this extremity and apply equal amounts of pressure to the whole thing, and then really just occlude any more blood flow down through that extremity and potentially save the life of that person. So again, we'll be showing this later in the presentation with some skills, hands-on skills, and what we could be doing with that. And so next we're going to start discussing fractures, splinting ideas, and what we can do with some of that. So now on to fractures and splinting. So smaller fractures, you'll start out with some of these here first. As you can see in this x-ray here, this is either a tibia or fibia. If you're out in the field, you're obviously not going to see that that's a broken bone. The patient's probably going to be complaining of some pain, some tenderness to that area, probably pain with range of motion, things like that. So, these may not be obvious, and it can happen really with any bone, these small fractures. And even some of these can, be remedied with splinting, and especially creating some type of comfort for the patient, until they get seen by ortho or get put into a cast, or whatever the treatment may have. And so, with some of these things, we could talk about later on, like they could just, if you had a SAM splint by chance, you can put a SAM splint on there, wrap it with some cling, kind of support that, prevent any movement. Even if you didn't have something like that, you can use a pillow, a large pillow. Those have been used back in the day. Even cardboard with some foam padding in there has been used. So small fractures, it can happen in the fingers, the hands, the wrist. Hyoid bone can even be fractured. Now, I don't know how we would necessarily splint that one, but again, these small fractures may not be super obvious compared to long bone fractures or these angulated or open fractures. So, seen in these photos here, I'm sure everybody's seen this type of splinting that we have here, and the buddy splint. Some folks call this. This is kind of common in really in everyday areas of the world. So, let's say you break a finger or you break a toe. There's not a whole lot to do it if it's like a minor break. Now, obviously, you always recommend going to a doctor, seeing them, getting X-rayed, seeing if anything is done. You might need surgery, who knows? But simple splinting for the time being, though. Let's say until you get to more definitive care, you could do buddy taping. And so, if you break a finger, whether it be these two or these two or these two, I'm sorry, if you break this one next to this one, vice versa, you can always use the other finger or its buddy finger and create a buddy, and you can tape them. If this finger is the one that's fractured, you don't want to keep moving this thing around, and if it's just flopping around, it's going to be probably pretty uncomfortable. So with that, you can either tape it to this one, use this as a split here. You can go above and beyond and tape all three of them together and splint it on both sides. That can kind of help prevent any movement, without moving the others. And then again, it's just supporting it. And again, you can do that with your toes as well if you have a broken toe down there. So you can use tape. Everybody, I'm sure, has some type of packing tape, duct tape, electrical tape, within the house. Let's say you also have a popsicle stick. You can use a popsicle stick. That's been seen multiple times. You can put a popsicle stick on the other side of your finger. That can also prevent bending. And so you can put that on the bottom. You can put popsicle sticks on each side. They even makes, like, you can go to CVS or Walmart or any of these big box stores and buy a finger splint. You might even get prescribed one from the doctor's office or ortho, whoever you go see for this. So splinting a finger, it's kind of one of the simpler things that you can do with just tape, if that's all you have. So long bone fractures will require a little bit more than just some tape and then taping it to your finger. Long bone fractures can be a lot more serious than a broken pointer finger or your broken pinky toe. And this kind of ties in too with some of the vascular system as well. So your long bones, like your humerus, what runs along next to that, your brachial artery, and then going down to your femur. Your femur is adjacent to your femoral vein, femoral arteries, and then just so on and so forth. Like your radial ulnas, your radial artery, you got things down there. So long bone fractures are pretty important when it comes to splinting, because you don't want those bouncing around and nicking one of these major vessels that run adjacent and near them. And so splinting them is important, and it's also good to also recheck PMS, your pulse, motor, and sensory post splinting for these longer, larger bones throughout the body. And as depicted here in the picture, you can see this. It appears this guy obviously has some type of leg injury there on his right leg, And they used a rifle here to splint going alongside the right side of his body. And I'm not really sure. We can maybe speculate, maybe like a knee injury or something here that could have happened. And you can see they have a band going right here across from his waist, around his waist, probably goes all the way around, secures his gun to his body. You've got one right here in the middle of his femur, and there's a pretty decent gap right here, so we can maybe assume and extrapolate from this photo that this right here might be the area of injury. A little bit further down, you can see it's secured down to his leg and then secured down to his foot. And so you can see they're almost using the whole body of this gentleman here to secure and splint that leg. And again, it's just super important because you have all these major arteries coming down, flowing down, coming behind the knee, coming around and even hitting the top of the foot. And so we don't want, let's say if this is the injury, to come around and damage. You have this popliteal artery that runs behind this knee. So let's say if this was the injury, again, we don't want that getting nicked. So even, back whenever this photo was taken, who knows, 1800 sometimes, they were, seems to be pretty aware of supporting these injuries and preventing further injury. And so, obviously you're not going to carry a musket around with you every day. And so perhaps if you're in this, like austere environment, or maybe you're in a workshop, or, somewhere out in town, you're not going to have direct access to these. And so, specifically more so like the austere environments, like maybe you're out in the woods on a camping trip, and you break a leg or you injure yourself. You have quite a lot in nature. You have these trees. You can have large limbs from a tree that you can help use as a splint. And then just using like maybe articles of clothing to help secure that splint to that injured site. SAM splints are becoming really popular now, but before the SAM splints, we had the board splints, which was it was just a piece of wood with some foam padding wrapped in plastic. Obviously to keep it clean and whatnot, but those were just, a piece of wood made fancy that was used as a splint. And so in these austere rural environments, you could, go back to the roots of nature and use a limb or a tree to help support that injured site. This is Mr. Winston. He's going to be our volunteer for today. He's going to be our volunteer for the bleeding portion of this course. And so we're going to kind of go over from the beginning about the minor abrasions, minor bleeding, and then work our way up from there. And so we're just going to cover some of those basic things you find around the house. So let's say Winston's outside, he scrapes his arm, gets a little bit of minor bleeding. What we can do with this minor bleeding is just obviously some direct pressure like you can see here with your hand. If you don't want to do that, you can take a shirt and apply that directly over that as seen here. Again, just once you apply it, don't remove it, kind of deal. You can always apply a Band-Aid over this as well, if that's what you have. And usually for this minor stuff, you can get away with that, just applying a Band-Aid to these types of wounds, especially capillary bleeding. Now, let's say he has some abdominal injury, large evisceration, cut himself open, there's just, blood everywhere. So with this, we'll need some large bulky dressing to cover that wound, because we want to be able to stop the bleeding and try and help slow it down. So again, you can use a t-shirt that you have readily available. Again, apply it over the wound as seen here. Apply direct pressure to that wound and don't let up off of it. And let's say, for instance, you don't have this shirt with you. For some reason, you could be at like a pool or out at the beach and there was like a freak accident. You can always use a towel. A towel is a great source to use. And again, you're just going to grab that towel, apply direct pressure, don't ease up, and continue on with that. So next we're going to talk about arterial bleeding, what we can do for that within the field. So here what we have is a CAT tourniquet. That's one of the trainers that we have. Like we said, not everybody's going to have one of these with them. if an incident ever occurs. And so we're just going to take this and just put this aside. As mentioned before, belts, people have always used belts, especially in the movies. And a belt, when applied, it doesn't necessarily make a full kind of compression around the wound, as you can see here. And with that, you're still going to have pedal pulses. You're still going to have a lot of blood coming out from the area. While it will add some pressure, this isn't the most ideal thing to use. And so what could be used though is if you have like a scarf or a t-shirt or something laying around, this is really the best thing that you can use here, is because you're going to get the width that is safe to use, you're not using like shoestring or anything. And then you're going to have a windlass. And here we have some wooden spoons that we can use for our windlass. And you can use like a flashlight, a screwdriver, or something along those lines, something that's sturdy enough to create tension when twisting. So what we'll do here is we'll just put the shirt around the victim's leg, and you're going to tie one knot first. Tie that tight as you can. You're going to take your windlass and set that right over. You're going to tie one more overhand knot, and then a third one, and then you can start twisting on this. And so the trick though when you're twisting this is you want to lift up, like shown here, because if you don't lift up, you can actually pinch the skin of on the patient's extremity, causing more pain and then more damage to the area. And so we're going to do this. We'll check pedal pulses, make sure there's no more blood pulsing out of there. So again, this is just one thing that you can use using a shirt, using like a windlass, a flashlight, or a wooden spoon to help stop that, create a tourniquet. Not everybody's going to have some gauze like this, or they're not going to have quick clot or something to pack a wound, or combat gauze to help slow the bleed. So just using what we have around can really help determine the fate of this patient. All right, so now let's talk about long bone fractures and splinting with our patients. And so with the lower extremities, we have our femur, our tib fib, or kind of our major bones. And so with these fractures, there's going to be a lot of a pain. There might be some obvious deformities, some angulation with this. And so we'll come to these later and discuss how we can splint some of those with what we have around the house. So moving up to the upper extremities here, we could talk about using, again, household stuff. So these wooden spoons are perfect. We can see you can use those here for splinting like a radial or ulna fracture here. And again, we can just use some like tape if we have some, not wrapping too tightly, and then still keeping a spot open to where we can check for radial pulses on the patient, checking for that pulse motor sensory motion after splinting. Even just turning the spoon around like you see right here, you can just get a lot better access at that radial pulse. It's always important to remember too, once you splint a extremity, you could secure it to the body. So, this forearm, if we had broken a bone here, we can put it in a sling and kind of secure it to the torso, so that way it's not bouncing around during transport. So moving on down to lower extremities, again, back to our basic anatomy, we have our femur, our tibia, and fibia, these three major bones here in the lower extremity. And these can be causing extreme pain for a patient if fractured. And these right here can also show obvious signs of deformation, angulation, shortening, inward outward rotation from an injury and a fracture. And so the thing is, we want to stabilize these and prevent these bones from moving around, and then the potential as well, we don't want to nick an artery or a vein or any major vascular system down in the lower extremity. So we really want to take caution and securing these and not having them bounce around. So just reaching around the house, I was able to pick up this flashlight that I have here, and this is long enough to support a lower extremity fracture, and you can use it to splint it. And you can use anything from a broom handle, a piece of lumber that you have sitting around the house, long as it's fairly straight and sturdy, and you can place it next to the patient's leg, we can use that to help stabilize a fracture. So taking this, we can place this right here, parallel with the patient's leg, and as you can see, it's pretty good in length. You could use tape if you wanted to, but honestly, like if you had like a scarf or again like a T-shirt, that would kind of really be best to secure this to the patient. And so what we'll do is we'll put this underneath the patient. And just a side note, it would really be best to do this with two people, if situation permitted to do so, because as we remember, you want to support above and below the site of the injury when moving or splinting, lifting the patient's leg. So here we're just going to put this underneath the patient's leg, put it around our splint, and we're just going to go ahead and do a overhand knot like this. And then again, we're going to just face these out little by little. This right here, we're just going to say is our injured area. And so with that, we never want to tie directly over the injury. We want to try and avoid that. That would just be adding injury on top of injury, and it would be extremely uncomfortable for the patient. So now what we'll do is we'll take another piece of fabric or shirt that we have, and we'll go above the site of the injury. And again, sliding underneath the patient, we're going to do an overhand knot, do a couple of those, securing that to the patient. And just as reminder, once you splint anything, you want to check for pulses. Make sure that they still have good pulse motor sensory to that area that you had splinted, whether that be the lower extremity or upper extremity. Now moving on to the like hands, and this can also be synonymous with the toes as well. We're just going to say that the patient had broken her index finger here. It's broke. It's not movable. It's just super painful. So what we want to do is we want to take this adjacent finger, and we're going to use that as our splint. And what we're going to do is we're just going to put them side by side, and we'll take some tape that we have around the house, and we're just going to lightly tape them together, making sure that the patient's comfortable, or yourself is comfortable if you're having to do this yourself. Do this a couple times. Keep them together, keep them parallel, keep them splinted until you can go see your doctor, or you can rough it out of the house. You can also use like a popsicle stick to place underneath the finger to keep it from bending forward, depending on how painful the injury is. And so you can see here that we have splinted these two fingers together. One being injured and one acting as the splint. So next we're going to move over here and just show you that the patient had broken her middle finger, how we can use her adjacent fingers on each side as well to create a little bit more splinting. And so it's just going to be the same technique. We're just going to take our tape, and instead of taping two fingers, we're going to tape three. In my opinion, this creates a little bit more splinting, more support for that middle finger. And then also, too, it just kind of helps remind you, like, hey, I got a broken finger. I probably shouldn't be moving this thing around. So, again, just taping these together, making sure it's comfortable, making sure the fingers are not turning blue, and then just, keeping an eye on it and visiting a doctor. And so that's just kind of a brief overview on our splinting, our fingers. And again, this could be used for toes as well.